end. Still no end to the doctors' strike. Strike threats from the nurses and clinical officers left at the last line of treatment have placed Kenya's public healthcare system on trial. But at what cost, you may ask? Well, the human suffering nearing 60 days cannot be underestimated. More than 300 lives lost seeking healthcare, a basic service, making this one of the most, or the worst, health tragedies in recent times. KTN's Dorcas Wangera tells us the real story behind the headlines you've been reading and watching.
December the 5th, 2016. Day one of the crisis currently in Kenya's public healthcare system. Doctors in public health facilities down their tools. But even 3 weeks before, there already had been a strike in the county of Embu, a sign of worse things to come.
We cannot afford to spend so much money building a big hospital like this, and then there are no services. 3 weeks without health services in a big hospital.
But was anyone listening? Day 59 and counting, 4 women are detained at a private hospital in Embu County of outstanding bills. 3 of them are detained alongside their newborn babies, as the 4th one lost her baby at birth. Irene Karimi, Catherine Wanja, Lispa Wanja and Naomi Kaleche are still here, unable to leave. They cumulatively owe the facility more than 400,000 shillings. Naomi Kaleche, who lost her baby, comes from Kitui County. But like the other mothers, she came to Embu seeking medical attention in a private hospital owing to the paralysis in public hospitals.
Mtoto akaniacha, lakini mbiru ikakuwa mingi. Ikakuwa 80,000. Na mzee wangu alipokuja huku alienda kabisa, hata hakurudi tena.
The irony is that maternal healthcare in principle is free in Kenya. At least it should be. But when public healthcare collapses, private practice has no provision for that. Robert Njagi, the facilities director, says he could not turn the mothers away.
All of us know the implication of pregnancy complication. So I first serve the patient either with the money or without the money. We have talked with them and relatives. We have agreed, because this being a company, I just cannot release them and I'm also in business. We decided to tell them to ask relatives to bring food to them, take care of them until they pay.
The strike days have had a grave human cost, some of which arguably preventable. Bahati Taabu from Taita Taveta lost 5 children while giving birth. She had to cross over to neighboring Tanzania on a motorcycle to seek maternal health. She gave birth to 4 boys and a girl. But sadly, instead of coming back with joy, she brought them home to be buried. They all died after developing complications. Taabu is heavy laden.
Mgomo si kitu cha ambao kinastahili, yani hata kile kitu mimi nilichokuja nikaona, nilihangaika sana na nikaona daktari ni kitu muhimu sana.
Bado watu wanahangaika, bado mgomo unaendelea, wamama wanahangaika, wamama wajawazito, hiyo kitu inatokeaga tu ni emergency.
The effects of the medic strike are far-reaching, many developing complications. Though the Ministry of Health has not released any official figure of lives lost, more than 300 people have succumbed to ailments. In the first 3 days of the strike, 20 people had died, as stated in the President's statement. At that rate, the number has well passed over the 300 mark. Those dying at home still largely unaccounted for, unlike those in private facilities. Kenya's public healthcare system is bleeding. The 2 national referral hospitals are crippled, and the Kenyans at the margins are paying the most for it. More doctors in public facilities, available diagnostic tests, cheaper healthcare, quality emergency care, drugs, research, and better equipped hospitals can revive the system. But how many more lives need to be lost? Dorcas Wangera, KTN News.